palpation is the last procedure of the abdominal examination. It's the most important and difficult. You should pay more attention to this part. There are some preparations before the palpation. For the patient, after the urination, they should be in supine position and keep relaxed. Breathing slowly and deeply can help the patient calm down. The physician needs to stand on the right side of the patient. Before the palpation, the physician should keep the hands warm to avoid stimulating voluntary muscular spasm. The female physician also needs to cut the nails to avoid hurting the patient. While doing the palpation, use the flight of the fingers. Place the hand on the patient's abdomen. Exert some pressure to see the patient's reflection. Here are 4 basic palpation methods: the light palpation, deep palpation, bimanual palpation, and blotment. For the light palpation, the depth is less than 1 centimeter, and for the deep palpation, the depth is more than 2 centimeters. Sometimes we need left hand to assist right hand to do the palpation. That is bimanual palpation. If there is lots of fluid in the abdominal cavity, the blotment palpation is needed. Among them, the light and the deep palpation are the most commonly used method. The light palpation can detect tenderness and muscular spasm or rigidity, while the deep palpation can determine the organ size as well as the presence of abnormal abdominal masses. It can also determine the tenderness and rebound tenderness. This is the bimanual palpation. We need the left hand to assist the right hand to do the palpation. For the preliminary understanding of the whole abdomen, the palpation is counterclockwise, started from the left lower abdomen. The basic palpation principle is from the healthy part to the lesion part, from light palpation to deep palpation. The contents of abdomen palpation include the tenseness, tenderness, and rebound tenderness, viscera, and mass. First, let's learn the abdominal tenseness. The abdominal wall in the normal person is soft, but in some cases, the abdominal tenseness is decreased like cachexia, while in the other cases, the tenseness is increased, such as board-like rigidity and the down-kneading sensation. Rigidity is involuntary spasm of the abdominal muscles and is indicative of peritoneal irritation. Rigidity can be classified as diffused and localized rigidity. In patients with generalized peritonitis, the abdomen is described as board-like. If it's over an inflamed appendix or gallbladder, the rigidity is localized. The kneading sensation means the abdominal wall is not soft. It has resistance and is not easily depressed. The examiner has the sensation of down kneading. It's usually the indicative of tuberculosis peritonitis or cancerous peritonitis. The second content of palpation is tenderness and rebound tenderness. After the general palpation of the whole abdomen, pay attention to the location of tenderness. Notice the expression of the patient while doing the palpation. Tenderness is easy to understand. Then let's see what is the rebound tenderness. Press firmly over the painful region or distant from the tender region, and then suddenly release the hand. If the patient feels a sharp stab of pain in the diseased area, or the pain is worsened after withdrawal. The rebound tenderness is present. It's a reliable sign of peritoneal inflammation. Generally speaking, the tenderness location is often consistent with the anatomy location of the corresponding organs. For example, when cholecystitis occurs, we will feel the pain in right upper quadrant of the abdomen. The commonly seen acute abdominal diseases include the acute cholecystitis, pancreatitis, intestinal obstruction, gastrointestinal perforation, and the torsion of the pedicle of ovarian cyst. These diseases need emergency management in the clinical practice. You should pay attention to them. There are also some urinary tenderness points, which are indicative of pyelonephritis, urethral stone, and renal tuberculosis. In the front, there are hypochondriac point, upper and middle ureter point, while in the back, there are vertebral costal point and costal lumbar point. Hypochondriac point is at the front of the 10th rib, corresponding to the renal pelvis position. Upper ureter point is at the outer edge of rectus abdominis at the level of umbilicus. Middle ureter point is at the outer edge of rectus abdominis at the level of anterior superior iliac spine, corresponding to the second stenosis. In the back, there are vertebral costal point and the costal lumbar point. The vertebral costal point is at the vertex of the intersection angle of the 12th rib and the spine, while the costal lumbar point is at the angle between the 12th rib and the outer edge of lumbar muscle. The left one is the vertebral costal point, and the right one is the costal lumbar point. The next palpation contents are viscera, including liver and spleen palpation. I will introduce them in the future class. If an abdomen mass is suspected, we should pay attention to its location, shape, size, mobility, tenseness, and bruise with stethoscope. Today, we learned the basic knowledge of the palpation. You should practice after class. That's all for today. Thank you.